Good afternoon, everybody. My name's Jocelyn King. I am chair of the multidisciplinary BAME network in the Trust.
My name is Noni. I'm the ward manager for the emergency medical admissions, and I work with the BAME network as one of the events leads.
I'm Nafsika Thalasis, and I work for a local charity called the BME Health Forum.
I'm Sandra Adji-Wilson. I'm a senior staff counsellor and I work for Contact.
The fact that we should be leaders in this agenda. We have 53% and rising staff members who are BAME. You know, we should not be following other trusts. We should be leading on this agenda.
Everyone was scared, and most of our nurses, especially at Imperial, are actually BAME. So as a manager myself, I actually had tearful moments because first of all, I was worried about the patients. I still wanted the Imperial to provide the same sort of care that we provide during normal times. The first month was really tough because people did call in sick, and at that time we didn't have any testing for the staff, and they were BAME. I was so tearful. I didn't even know what to say. I went in the kitchen, I was crying, and mind you, I'm the manager. I'm meant to be strong, but I was scared. If any of them do get the COVID, I would have felt very responsible. The trust has since improved because they provided what they call a PPE group that come to check our level of masks or face coverings or anything that we need per day. They come in every morning, they speak to either myself or the nurses in charge and make sure that we've got enough to last us till the following days. We then got the ward helpers, which were quite helpful actually, because the ward helpers would actually stand at the door and help people to wear the PPE appropriately.
One of the many reasons why there is a fundamental distrust between BME communities, especially first-generation migrants who have the language barriers, and the NHS. And I think that patients feel that communication is treated as a one-way thing. So there's interpreters when the doctors want to talk to patients. There aren't interpreters when the patients want to talk to the doctors.
They've been very much about feelings of powerlessness, fear, and sometimes shame. The first layer of fear is like anybody else in the NHS, but another layer is actually I'm more predisposed to this, and we don't know why. But we're still expected to come in and do the same thing as our peers. That's right. Yeah? But yet, so what about me? Aren't I important in all of this? And so there was a self-assessment, risk assessment, and those people who did feel they can speak out, they did, and those who didn't, their stress went through the roof. Grown men coming in crying because I have young children. I'm the only breadwinner. If something happens to me, what's going to happen to my children? So it was to another height when it came to BME people. When we expanded our service, we expanded it to include telephone counsellors as well, and also evening counsellors, weekend counsellors. And one of the things that was coming through from a lot of BAME people was that we are scared to come in. The next step now is actually about the reintegration of staff back into their teams, and that's a potential issue regarding relationships for those people that were here through the pandemic and those people that were shielded or not. And also when we think about patient care, if we're not supported, that will translate to the level of patient care.
If you manage about 30 people, you need to make sure they're coming into work, how they're coming into work. We got hotels for staff. I never stayed in one. We got transport for staff to come in. We got lots of stuff for the staff to be comfortable to come in. But you're doing that to make sure the department is running.
I think the next issue now is that so many services seem to be delivered on the telephone or online, and that excludes people. I mean, again, if we're talking about somebody who might speak a bit of English but not that much, it's much harder to have a conversation over the phone than you would face to face.
Where we are now with the transparency of it's no longer keeping quiet and benefiting from things quietly. And I think it's about making things explicit, actually, and the things that you couldn't say or didn't feel you could say. Now it's time to be saying it.
We have developed BAME ambassador roles, and the BAME ambassadors are going to be staff members who are going to be the link from their little community groups, whether that's fellow staff, whether that's, other types of groups within their services, who are then going to be the bridge between their group, the BAME network, and the EDI committee. And so hopefully if there are concerns, we get to address those concerns immediately. There's no gaps to fill. BAME is such a huge umbrella. It is such racially, ethnicity, in terms of ethnicity, culture, it is a massive, massive umbrella. And so within sort of like Black BAME, you've got African, you've got Caribbean, you've got Black British, within Asian, you've got Pakistani, you've got Mediterranean, it's just massive. And so it's really, really important that those ambassadors hopefully then tap into those localised groups and bring it back in so that we, like I said, we address those concerns.